Welcome to today's episode of the Be Sure podcast. Living with epilepsy involves challenges beyond seizures, including stigma and emotional impact. However, with the right treatment and adjustments, many people with epilepsy can lead active lives. To help us better understand this, we are fortunate to have a renowned consultant neurologist with extensive experience in treating epilepsy. Welcome, Doctor.
Hello everyone, I am Dr. Vibhor Upadhyay. I am consultant neurologist at Medanta Hospital, Lucknow.
Let's start with the basics. What exactly is a seizure and how does it affect the brain?
So basically, the brains used to produce some electrical activity regularly, as our heart does. Similarly, when this electrical activity becomes some irregular type or sudden outburst of electrical activity happens in the brain, so it leads to some electrical phenomena which is clinically evident as in the form of seizure, which we usually see like jerking of bodies, and it can be of many types. While the most layman usually sees it as in the form of jerking of the whole body. So basically, it's a electrical circuit mishappening happening in the brain, leading to sudden outburst of electrical changes.
What is epilepsy?
So seizure is a symptom, as I told. The reason behind its irregularities in the brain electrical circuits, and epilepsy is a diagnosis which we give to a patient when he had two unprovoked seizures more than 24 hours apart. Then medically we can diagnose him as a case of epilepsy. So whenever a patient has two unprovoked seizure means when there is no cause for happening of seizure, like electrolyte imbalance or high grade fever or head injury. In those cases, we say that was a case of unprovoked seizure, and then two patients having two unprovoked seizure more than 24 hours apart. So we label him is as a case of epilepsy.
What are the different types of seizures and do they affect people differently?
Yes, so seizures can be of various types. The most common which we see is the generalized tonic-clonic seizures, which usually layman remembers because as it's been shown in the movies or they have seen patients around their neighbors, like sudden jerking of the whole body. But sometimes seizures can be of as last for few seconds in case like sudden patient will have a feeling of fear or loss of consciousness only, or a patient will have absence minded means he will uh, lost in his own thoughts and will be cut off from his surroundings. And sometimes focal jerking can also happen with preservedness of consciousness. So in seizures can be of various type where consciousness can be preserved or there could be a loss of consciousness also.
I see. Now, can you explain what causes epilepsy? Is there always a known cause?
So not always there is a there is a known cause of epilepsy. So for about half of the adult patients, the cause is not yet identified after doing a exhaustive workup. But in 50% of the cases, we do have some causes like structural brain disease is the most common cause. Like patient could have some tumor or patient could have some abnormality in his formation of brain, which could be from birth, or patient can have some calcified lesions or abscess, could be a tubercular or bacterial, which can cause these electrical disturbances in the brain and in the form of seizure they can represent. And in elderly patients, that is more than 65 years of age, there are stroke can be a cause, or sometimes some degenerative dementias can also land up with the in the form of seizures. And definitely genetics is one of the cause in which the family history is important, and some there are some genetic linked epilepsies which runs in a family. So family history also becomes important as a cause of seizure in some genetic linked epilepsies.
Well, that's really helpful to understand. Well, what are some of the signs or symptoms of epilepsy that caregivers should look out for?
So there are different symptoms as we already discussed in the form of what types of seizures are there. So symptoms can be as easily evident and easily identified, like generalized seizure, in which patient will have generalized jerking of whole body with uprolling of eyes, with frothing from mouth, or sometimes there is urinary or stool incontinence associated with these episodes, which are easily identifiable, and the layman or any family member usually easily recognizes them as seizure. But sometimes we need to understand that there are some epilepsies in which these symptoms do not occur. Patient will have sudden jerking of any limb of the body, or focal twitching over the face lasting for some seconds, and consciousness will not be lost in these cases, which are focal epilepsies. And in small childs less than 6 to 8 years of age, the most common epilepsy is absence epilepsy, in which the patient will not have these kind of symptoms, and the child will lose consciousness from his surroundings and will sway away in his own thoughts, and he will be cut off from the surroundings, like becoming absence minded. So these are the this is one of the most common cause of poor school performance in the child. When school teacher says that the child was doing very good in this class, but suddenly for last few months he's academically he's getting deteriorated. So absence seizures are also one should keep in mind, especially in the child population.
Now let's talk about something that many people with epilepsy face: stigma. Can you tell us why epilepsy is often misunderstood?
Yes, this is one of the very good question relevant to our country. Unfortunately, epilepsy has been very badly stigmatized in our country, and this has been misunderstood for a long time, because historically people didn't realize that epilepsy is a neurological condition, and they used to get fear when they see a patient having convulsions. So they usually attached it by being a fear frightening episodes, or react with fear, or avoid those peoples. So this and some people usually stigmatize as that it can come by touching the patient, it can come to you also. So this stigma has to be removed from our country.
Absolutely. Now let's move on to managing epilepsy. What are the common triggers for seizures that patients and caregivers should be aware of?
Yeah, so epilepsy, most common triggers should be identified, because in spite of taking medicines or treatments, if you don't avoid triggers, then epilepsy can be precipitated. So, like most common trigger which we see in our OPD patients is the missing sleep, especially in generalized epilepsies like JME, which is one of the common epilepsies. So, one should not miss his or her sleep. Is at least 6 to 7 hours of sleeps per day is very much necessary, because when once you sleep less, the electrical activity in your brain becomes heightened, and then can precipitate the sudden abnormality in your electrical current in the brain, leading to the formation of seizure attack. So missing sleep is one of the most common trigger one should avoid. Then taking high stress, which is now a common factor in, I think, every individual nowadays. So high stress levels, so one should take due time for himself, do meditation, relaxation exercises, spend time with family friends, so as to keep stress levels down. Then skipping meals or certain foods may trigger epilepsy. So one should know what are those things associated with each individual, and one should avoid those. Then in children, this reflex epilepsy, like flashing lights, more screen exposure nowadays, which is very common in the children age group. So one should avoid giving smartphones or making child watch TV for very long time in a day, should be avoided. Then any in childhood time, febrile seizures are very much common, so one should keep a check on the fever. If a child is having fever, so one should always take measures and uh, try to keep fever under control, because high grade fever tend to induce seizures, which are called as febrile seizures. Similarly, missing doses in a epilepsy patient who are on medication, if they are missing their doses, so that is very much precipitant. Skipping doses or forgetting to take a pill will definitely induce a seizure in those individuals. And for women with epilepsy, some hormonal changes, especially during menstrual cycle, some patients tend to have seizure tendency, which is known as catamenial epilepsy. So those women should take always note down their cycle and should take always consult if they are having a high chances of epilepsy during their menstrual cycle. So doctor should always add some other drug during their menstrual cycle period so that that can be taken care of and seizures are not precipitated.
Thank you so much, Doctor. To wrap up, could you share some safety tips to help prevent injuries during seizures?
Yes, so this is very important. As a caregiver, one should know how to take care of the seizure patient in their family or neighborhood. So, what I always advise to my patient is they should always remember triple S. So, one is whenever you see a patient seizing or having convulsions, you should first take the patient to a safe site. Like if he is lying near pool or he is having seizure in on the road or around any place where he can have injury while having seizure. So you should first take the patient to a safer side. If he is convulsing on the road, you should first take to him to the side of the road or near water. So you should take the patient away from the water or fire if he's around there. Second assist, you should stay with the patient. One should not frighten and run away or call for help. You should stay with the patient because this is the time that patient needs someone around him because he has lost his consciousness. And third is make the patient to lie down on his side. So safe. Second S is stay with the patient, and third S is make the patient to lie on his side, because once you make the patient lie on the side, so the tongue would not fall backward and choke his airway, because on the back side sometimes tongue may fall back and choke the airway and patient may die because of asphyxiation. So when you make the patient lie down on the patient while having convulsion by the side, so tongue fall will not happen, and seizure usually happens for less than 1 minute, max to max less than 1 minute or few seconds, and after that patient may become little drowsy, but his seizure activity will stop, and then later on you can consult a hospital or doctor. So these safety measures one should always take, and then on the after seizure stops, patient regain consciousness, then you can take him to the doctor or hospital.
Thank you so much, Doctor. This has been incredibly informative and helpful. We hope today's discussion helps listeners better understand epilepsy and how to support themselves or their loved ones, of course. Any final thoughts?
So I just want to say that just remember, with the right treatment, many people with epilepsy can manage their condition well and lead a full life. So there is no stigma should be attached with that epilepsy, that one should not cannot marry a patient of epilepsy, one should cannot give job to a patient of epilepsy. So they are the normal people. With treatment they can live a normal life as other individual. They should just be aware of their triggers. If they are on medication, they should use regular medication, take full sleep of 6 to 7 hours per day, practice healthy habits, take good follow good lifestyle practices, and this will make a big difference, and epilepsy patient would be like any other disease patient which can be cured with treatment. And remember, these patients are not alone. There's a community of support out there. One should combine and find their community people of epilepsy and support each other. And as a community members, as a society, we should always support them, and do not, especially in India, we should not put a stigma on these patients.
Thank you, Doctor. And thank you to our listeners. Until next time, take care and stay informed.